Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's episode, we will be bringing our final CEU episode of Season 6.
That's crazy. I feel like we just started Season 6.
You know what they say, time flies when you're having fun.
But before we get into our CEU episode, I did want to share one review that we got that actually was perfect timing because we did get this about a position statement, which is what we're talking about
That's
today.
what I was going to say.
So we got a review that's titled Useful Study Tool. I'm a master's student of athletic training and love this podcast as a study tool. Breaking down the position statements and giving real-world advice is super helpful.
Sweet.
Yeah, thank you.
That's really nice.
We get so excited when we get those. So thank you so much to whoever wrote that. We appreciate it a lot. It goes a long way. So without further ado, our CEU episodes. This is a CEU episode, which means that if you're listening to this and you are an athletic trainer who needs BOC Category A CEUs, stay tuned because you can listen to this episode and it will count for Category A CEUs. Thank you so much to our partners, Clinically Pressed and Athletic Training Chat. All of the details will be down in the show notes below. So if you're listening to this within the latest 5 episodes, it is a free CEU. And because it's our latest over the summer, this one will actually be free for a while. And if it's within our older episodes, then it is still purchasable. And those proceeds go directly to not only to support the show, but it also goes to donate cold tubs to athletic trainers around the United States.
Yeah. So speaking of cold, that is what we will be talking about. We will be talking about the position statement on environmental cold injuries just in time for summer.
I like how that works.
So for this episode, we'll be discussing the environmental cold injuries position statement. We'll be discussing some prevention techniques for events that are in the cold environment and discuss the role of the EAP when considering cold injuries. Which it's very interesting to talk that we're going to be talking about cold injuries considering like we're in Southern California and like this doesn't really come up a ton, but, and I believe I say it somewhere in here, is just because you're from a warm area doesn't mean you won't go somewhere cold.
It is so true. And you went to Minnesota?
Minnesota in October for cross country. And that is actually my real world example that will be coming out in this episode.
Things that you think you might not need and then you end up needing.
100%.
So we usually start with anatomy on these episodes, but with a position statement on cold injuries, I assume we're not going to do that.
No, we're just going straight into injuries.
Sweet. Let's do it.
So the position statement kind of broke down cold injuries into 3 categories. There's decreased core temp, freezing injuries at the extremities, and non-freezing injuries at the extremities. So really easy. So nothing too complicated here.
I feel like it goes scary to somewhat scary to not as scary.
Yes, exactly. So for the decreased core temp kind of criteria or category, you could probably guess what we're talking about, and that's hypothermia, which we can now further break down hypothermia into 3 categories as well. Yeah, we got the rule of threes here.
We got a little tree going on.
You have mild, moderate, and severe. Moderate and severe hypothermia kind of get grouped together, especially when we start talking about treatment. But there are differences, and we'll talk about what kind of separates them. For mild hypothermia, that's going to be anything between a core temp between 98.6 and 95 degrees Fahrenheit. Signs and symptoms that we expect to see are going to be vigorous shivering, increased blood pressure, impaired fine motor skills, so like your dexterity, right? You can't really grab things
like
as nicely.
When you're holding something cold, or like if you're sitting at my desk at work and your hand is under the vent all day long.
Yeah.
And then all of a sudden you can't really type.
Exactly. 100%. Your office is mild hypothermia inducing.
It is.
You can also have lethargy, apathy, and mild amnesia. Have you ever felt like you forgot anything in your office?
only when I concuss myself, but that was
That's fair.
was
That's
a different story.
That's a different pathology. Treatment for mild hypothermia is going to remove wet or damp clothing. Right, you want to try and insulate the patient with warm, dry clothing, and make sure to cover the head as well. We do lose a ton of heat because we have a very metabolically active organ in the dome.
When I was in school, there was a picture. Maybe someone can help me find it, but there was like a picture that shows like where your body heat comes off of and like what percentage. And it shows like your head and your ears and your feet and your palms and like other places. And it was so helpful, and I can't find it. So if anyone knows what I'm talking about, please send it our way so we can share it.
That'd be cool to find.
Yes, and I wanted to use it to show, but maybe I just need to draw one.
Yeah, maybe. Yeah.
But yeah, the head is a very important thing to keep. Like, just think like beanies.
Yeah.
Think about like all your cold weather gear. Those are the places that you lose heat.
Yeah, no, for sure. 100%. Obviously, you want to place them in a warm environment. So you want to kind of have them in a shelter where they're away from the wind and the rain, which we will talk a little bit more about the wind aspect. That's kind of a big deal in the cold is when we start talking about wind. Some rewarming principles for when you have someone with mild hypothermia is you want to apply heat to the trunk, axilla, and the groin. You really want to try to avoid rewarming the extremities. The reason for this is it can cause what's referred to as after drop. And what that means is it can lead to a drop in core temp again because cold blood is returning to the core. Right? So if you warm the extremities, it's going to cause vasodilation in the extremities. Now more blood's going to get there, but it still may not, like it still maybe still be exposed to the cold. So now it's taking cooler blood and bringing it back to the core. And then also, because the extremities lost some blood flow, there's some metabolic byproducts of that's just loose in the tissue. So if you add blood there, it's going to try and take that away, and it adds it to the core, which
you don't want to do.
Yeah, exactly. Your core doesn't want that when it's trying to fight off hypothermia.
Right. Let's just add more barriers.
Yes, exactly. You can also provide warm beverages with about a 6 to 8% carbohydrate concentration, and of course, non-alcoholic beverages. So the old school whiskey idea is actually detrimental.
The ones that the St. Bernards
used to carry.
Yeah.
But it's interesting with mild hypothermia. I actually think I had an athlete that had mild hypothermia.
Oh, did you remember to follow these guidelines?
For the most part, yeah. It was tough because we weren't the host like this. So this was my example of cross country in Minnesota when it's 8 degrees at race time. For the most part, I want everyone to know I wasn't worried about the cross country kids because at least they're running. Like they're going to be warm, like moving around. I was worried about me. I'm going to be standing there.
You also brought like 2 pairs of pants, which like I wear on a normal cold day here. And you're like, yeah, I'll be fine.
And I was.
And you had like a hoodie and that was it.
I actually was fine.
I don't know how.
I was actually pretty good. I mean, I feel like, again, we're from Southern California, so we don't really get cold, but I felt like it really was, it's just at a certain point, it's just kind of cold. Like, I don't know. Like, I don't think I would have noticed the difference from 8 degrees to 15 degrees. There was no wind.
It's how short you can be out there.
Yeah. But yeah, no. So yes, I do remember some of these principles. It's just tough because like we're not the host school, so it's not like my main medical area. And for some reason, I don't think I could get there. Like I don't know what happened.
So can you share some real world how to get someone in a shelter without having a shelter?
Yes. So this was a great story. So for cross country, right, when we're traveling, like I'm just there for my team. So like when they'd cross the finish line, I like account for all my kids, take care of them, and then like make sure everyone's okay. So I always kept track of who finished and if I was ever missing someone. So this is the one time that like I could not account for where one of my runners were.
Like at all?
At all. I was like, this can't be good. And I don't know how it came up. I think one of the other kids said she was in the medical tent. But again, it was weird. I couldn't get there. Like, I don't know why. Because usually if it's my athlete that's down, like I will go and then like I'll like take over from the host school.
Yeah, as it normally goes.
Yeah. So I don't know what happened. But anywho, they like released her with like one of the space blankets, which is going to be something we talk about. But you could tell she still was kind of like going through it. So here's what my strategy was. I did do the hot beverage. I waited in line to get hot cocoa to help warm her up. And then we had one of those fancy like vans that have the heated seats.
Oh, nice.
And that was our remove from the, or shelter from the cold. I told the coach, like, hey, we need to throw her in the van. Let's crank up the heat and put the heat seat warmers on.
Okay, so seat warmers is applying heat to your groin.
Yeah, and trunk, depending
and
where.
Trunk. And now you just need to, you could take the hot cocoa and put it on your armpits.
Yeah.
And then there you go.
Yeah, but also drinking it,
And
right?
drinking it.
That hits the core.
Mm-hmm. And there are your couple of rewarming principles.
Yeah. She actually did okay. She started kind of feeling better, but she was doing relatively okay. We went back to the hotel and like, of course, the whole team wanted to like shower and stuff. So I figured, she'll be fine. Like, getting in like the warm shower and stuff. So she started feeling better after. But yeah.
Just have a person on call or something.
Yeah. But yeah, no, that was, I'm pretty sure she had mild hypothermia. And I was like, all right, we prepared for this.
Okay, so that's mild. What about moderate and severe?
So going to our more kind of worst case scenarios. So moderate hypothermia is a core temp between 95 and 90 degrees. And then severe is anything below 90, which I feel like you're pretty much dead at that point. Like, that is cold.
Right.
Signs and symptoms can be similar between the two. It's really like a progression of decline that you see, right? So it's like moderate, things are starting to shut down, and then severe is things are shutting down.
Makes sense. So like mild, you saw vigorous shivering, but what does it look like when it gets worse?
When we start seeing things shut down, you stop shivering. Your body essentially says, I'm done. Can't do it anymore. Which then now you can't produce heat, because one of the most effective ways that adult humans produce heat is through shivering. Right? That is pretty much where we are going to be getting, like, generating our heat from. Mm-hmm. They'll have very cold skin. And if we're talking about severe hypothermia, it's going to be pretty rigid. Like, you're going to touch their skin and be like, oh my gosh, you're like ice.
You're like ice.
Yeah, exactly.
Because, I mean, we're how much % water?
Yeah, seriously, that's not wrong. They're going to have depressed vital signs. You're going to start seeing everything shut down, right? Their breathing rate's going to start dropping, their pulse, their blood pressure. They're going to have impaired mental function, gross motor skill impairment. So now just all movements aren't great.
So instead of just like fine now, it's like the bigger movement.
Yes. And then the biggest concern, well, one of the biggest concerns that come with severe hypothermia is the possibility of cardiac arrhythmias.
Not good.
No, not good at all. Treatment is going to be activating EMS and just be ready for CPR, especially when we're talking about cardiac arrhythmias.
How does that play a role, the rigidity of, does that affect CPR?
It didn't say. I didn't see anything in there that said it. I feel like it wouldn't, because like that's such a thin layer of skin up here.
That's true, because really the rigidity would come from the ribs, which the ribs shouldn't.
Are already
Yeah.
pretty rigid. So I don't think so. Maybe you hear more crackling when you do it. You're going to remove wet or damp clothing, right? You want to insulate the patient with warm, dry clothing. Make sure they cover the head as well. You want to get them in a warm environment, shelter away from wind and rain. If there isn't a physician there immediately, right, you want to immediately start rewarming. And this is a situation that they did bring up, that you can transport them, but you still have to be warming them while they're being transported, right? So it's not quite like heat stroke where you wait to cool, where you have to cool them, then go. Hypothermia can be rewarming and then transporting while they're still rewarming. You just can't put them in a position where they're like, you're rewarming, then like, okay, let's just stop and let's get going.
Well, I feel like it's a little bit easier to transport someone who is rewarming themselves.
Yes, than trying to cool.
Versus someone in an ice tub.
Yeah. What if they have a mobile ice tub?
They do. They have those like things that look like body bags that they fill in.
No, but I mean like a vehicle that has the ice tub in it.
You can patent that.
I feel like it wouldn't work. It'd be sloshing all over the place. If you brake too hard. Once a physician is present, more than likely they're going to order some aggressive rewarming strategy, which is actually pretty cool how the position statement described it. There's like heated IVs,
wow,
blood rewarming. Like I was like, yeah, you definitely need a physician for all that.
Yeah, seriously.
But also too, they might do some medications to address the possibility of arrhythmias as well.
Oh, okay.
But some complications after rewarming, so once they're kind of starting to normalize, is the possibility of infection or even renal failure. And it's really kind of like the same idea as heat stroke, right? You're probably going to expect a bunch of labs afterwards during follow-up to make sure kidney function, probably liver function, stuff like that, and probably an EKG, I'd assume.
Yeah, I feel like your body's a little fragile after all that.
Yeah, which to make things better with any cold injury, as with any injury in general, once you have one, you're more than likely going to have another one.
Like down the line?
Yes.
Your body's like primed.
Heck yeah. Primed to freeze. Not a good feature.
So you didn't learn.
So you didn't. That's actually what the body's saying, actually. That's a good way of putting it. So now that we've talked about freezing of the core, we're going to talk about freezing of the extremities.
So freezing of the core is scary. Freezing of the extremities is
moderately scary.
Yeah.
So this tends to be the fingers, hands, nose, ears, and possibly the feet right there.
Yeah, the ears.
Yeah, can't forget the ears. And our first kind of condition is the classic frostbite. And you could think of frostbite as kind of like being on a spectrum. All right, so you have like frost nip is your kind of like your first layer. Then you have mild, or also known as superficial frostbite. And then on the far end, severe, bad news, severe, or deep frostbite.
They should call it bad news frostbite.
I'm here for it. Please do.
Frost nip, just a little nip.
Yeah. It's getting a little nippy out. So that ties in perfectly to go dive into frost nip, which is also known as pre-freeze, even though I've never heard someone say that before.
I know, that's random.
Now this is really kind of cool because now you can actually start shifting to looking at skin temps, which we could kind of take skin temps. I took it as like surface skin temp, but maybe I could be wrong.
Interesting.
That was the first thing I thought of in my head, but
yeah, we don't hear much about skin temp.
Exactly.
We just hear more about like core temp.
Core temp. But frost nip will occur at a skin temp below 50 degrees. Signs and symptoms are kind of loss of sensation, vasoconstriction of the microvasculature. Right, you could see some plasma leakage, which could add some swelling to the extremity, or at least the area that's exposed to frost nip. The position statement didn't really describe any methods to treat frost nip, but in general, you want to kind of rewarm this area. So kind of like what I teach in my prevention and care class, which is basically coming from the Prentice textbook, is you really like you could blow hot air, you could add compression with a warm object, right? You can have that body part like against like your skin in a warmer area, so like sitting on your hands and stuff like that. Like stuff like that you can do to rewarm that area from frost nip. So as we progress from frost nip, because you didn't want to rewarm it, and you were like, hey, let's keep rocking with this. Mm-hmm. You went into mild frostbite, which is also known as freeze-thaw phase. I don't know where it got the thaw from, because it doesn't sound like there's any thawing happening with it. This will occur when there's a skin temperature below 28 degrees. So we're getting pretty cold.
Yeah, 50 already sounded cold.
I know, that's what I was thinking. Now you're at 28. You're like, oh, shoot. This is where you'll start to see those extracellular ice crystals start to form.
Oh, that's not good.
Mm-hmm. Yeah, it's not great. So literally,
become a human popsicle.
Yeah, literally. So when the fluid between your cells starts to freeze, that's what this is. So what this leads to is water leaving the cells to go to the frozen water outside the cell, which could lead to cell dehydration, which now there's an electrolyte imbalance. Eventually, this causes the cell to collapse. and die.
Scary.
Yes. As more ice crystals start to accumulate, it starts to add pressure to the microvasculature like capillaries and arterioles, which then could start compressing them, start closing them off, and damaging them as well.
Not good.
No. So your signs and symptoms will be edema. There may be some redness, possibly molted gray skin. And then they'll have some transient burning and tingling. The fun, cold stuff normally. Treatment is the one thing you have to start kind of thinking about with the treatment of this is you need to understand if refreezing is a possibility. So once you start rewarming, like you have to complete rewarming. You can't put them in a position where you're like, warm, okay, let's go out this way. We have to leave and do whatever and go back in the cold because it could refreeze and that could lead to tissue necrosis.
Right. I feel like any time you start rewarming, you have to just continue the process.
Yes. Yeah.
Like it's all or nothing.
Yes, exactly. But in general, once you're ready to start the process, you're going to remove any cold, wet, damp, or restrictive clothing. Rewarming can occur at room temp, obviously if the room's not cold. Or by placing the extremity on something warm or in warm water. But just keep this in mind. Like if you're putting it in warm water, it has to be done slowly, and the water temperature shouldn't be greater than 98 degrees. If it's
I feel like 98 is hot.
Yeah. Well, yeah, that's why it can't be higher than that. It has to be below. I
mean, like even 90 degrees.
Yeah.
Like that sounds hot to me. I would think more like a lukewarm.
Yeah.
Anything's going to warm them up, honestly.
Which you could. You could do lukewarm.
Right. I was also thinking, like, you know, the moist heat packs, the covers for them.
Yeah.
Like, put a heat pack in there, and then take the heat pack out, and you know how they're still warm.
Yeah.
You put your hand in instead of the heat pack.
Yeah, you could. Yeah.
It's still warm.
Yeah. No, those are definitely
It's like
options.
a heated blanket.
Yeah. You just really want to avoid friction massage because that could just cause damage to the skin. The skin's already fragile at this point, and you may have blisters from this. So if you came in and did friction massage, you just blow up the blisters. We're not trying to induce infections here. So now that you're still rocking with your frostbite and you're like mild's not good enough, I want severe.
We get scary.
Yeah. Right. This is also known as deep frostbite because it's cooling, like it's freezing tissue just deep. That's normally deep. So this can actually include muscle tissue and nerve tissue, which is crazy.
So before, with the mild frostbite, we were talking about some burning and tingling, which is nervy, but it was more transient.
Yes.
Whereas
it's not true, the nerve freezing.
Right. Whereas this is actually going to affect that nerve if you go into that scary, severe frostbite.
Yes. So signs and symptoms can be edema. You're definitely getting molted or gray skin. Tissue may be hard with no rebound, right? So again, like you're going to touch the tissue and it's just hard.
Human popsicle.
Exactly, human popsicle. They're going to have numbness or anesthesia. Treatment is somewhat similar to mild frostbite, but it's going to be a lot more aggressive. It's more like we need to warm this tissue right now. And you're probably going to need referral to a physician for this bad boy. So you're going to remove any cold, wet, damp, and or restrictive clothing. And you want to rewarm the tissue in warm water. This time, you want the 98 to 104
I feel like that's
range.
Hot water.
Yeah.
Who has
that's not wrong. That's almost hot whirlpool status.
Yeah, seriously.
Immersion should be about 15 to 30 minutes. You'll know thawing is complete when the sensation returns, color returns, and the tissue is a little more pliable. So it actually kind of feels like skin again. The only drawback to this can be a pretty painful process, as you could imagine.
As you start getting like feeling back.
Yes. And that's another reason why it's a good idea to probably refer this to a physician because they may order some analgesics to help.
So when you're talking about like it needs to happen immediately, like can we transport and then they rewarm?
Yes, if you were in that situation where, hey, I can't rewarm them with a physician, or like I can't rewarm them and then not put them in a position where they're going to refreeze, you can transport them, but you're going to want to, again, remove the damp clothing and put like dry clothing on it and keep it covered from the environment. So you can transport before rewarming if you're in a position where I can't safely rewarm this without it refreezing.
But like if you're going to safely rewarm it, that would be 30 minutes of painful at least.
Yes.
It would be almost better to just package to send.
Yes, and have them rewarm there. If there is any damaged tissue, so like how it described is in the position statement, tissue sloughing off.
Oh,
I know. When I heard that, I was like, that just makes your skin curl.
That just gave me the chills.
Yeah. Infection control obviously will be necessary. So now to the least scary of the cold injuries, the non-freezing injuries of the extremities, which I think are a little bit, some of these aren't quite like expected in at least a traditional athletics realm. One might be, and that's chilblain. But also there's immersion foot or trench foot, which you're kind of like, okay, I may not see that in traditional sports.
No, but you'll see it in the Army.
You'll see, yeah. Well, that's what I'm saying. Like not traditional sport, but like there are obviously settings where that will be a more prevalent than others.
Right.
So both of these conditions, chilblains and immersion foot or trench foot, involve exposure to cold, wet environments, but this time it's for long durations. Right. So like frostbite, the spectrum of frostbite, hypothermia, right, tend to be in like really cold environments. These kind of injuries are more like in moderately cold, but you're in it for a long time. So chilblain is usually about anything over 60 minutes at temperatures below 50 degrees.
I feel like you can get some sports that are like that.
Yes, no, and that's what I was going to say. Like, think about how many times you're like a football game's 3 hours, or like baseball, or like, you know, like there are definitely sports that are like that. Whereas immersion foot, you're kind of looking at least 12 hours to 3 to 4 days, which that's why it was called trench foot, is because it was prevalent in World War I, because they're in trenches for days and it's cold and wet,
right.
and just not the most fun environment.
I wouldn't say so.
No. Right. And what these conditions are characterized by is it's basically an excessive inflammatory response. Right? You're just in a cold environment, which is stressful to the body, causing some damage. It's wet. Your body goes into inflammation. So you're going to get, I'm probably going to butcher this because I always butcher it when I say it, erythematus.
That was better than I would have thought. So
papules.
What does that mean?
It's like the red dots.
Oh, okay.
Like blotchy red, like yes. Edema, of course, so you're gonna get swelling. It's gonna be itchy, burning, tingling, and pain.
All from the nervy?
Yep. And the swelling.
Ah.
And then for trench foot itself, that may also add in blisters. There might be more cyanotic tissue, and you can actually start seeing damage to the skin, like skin fissures.
And it's sloughing off.
That would be bad. That sounds gross. For chilblains, you want to remove wet and constrictive clothing. You want to elevate the limb and apply warm, loose clothing on there.
I had to think about elevating the limb for a second because I almost wanted to say that I would have not wanted to elevate the limb because of sending it back to the heart.
But I think it's okay because it's not like a severe cold injury to where you're sending metabolites back.
That's fair.
Yeah. Immersion foot is somewhat the same, right? You're going to clean and dry the feet. It's specific to feet because it's immersion foot.
Right.
You can apply warm packs or soak in warm water, which is around 102 to 110.
How random of a specifics for all three of these?
For about 5 minutes. So those are your cold injuries.
Sweet. So what do we do to prepare for if one of our events is going to be in the cold?
So that's the thing. It really kind of like when we're talking about preparing for cold events, it just depends where you are on the map, right? For us, right, in Southern California, places in the South, right? Cold events don't come up a lot. But then our friends up in the North, this is probably an everyday thing that they have to prepare for.
Yeah, you guys can teach us about
Yeah,
this.
not wrong, right? I'm sure, and I would love to hear more from athletic trainers that are up north that have to deal with this like on a day-to-day basis than we do. Right, but again, like we kind of said, it's still important that even if like you're not in a cold area, at some point you're probably going to have a competition or your athletes are going to be in a cold environment, which is again what I had to deal with cross country. Whoever said, I'm going to schedule a Minnesota meet in October. It was a great idea.
Yes. An outdoor.
An outdoor for a Southern California team to travel.
Yes. I'm sure they felt that they had an advantage.
Yeah. Hey, it was cool for us because it was in Minnesota. So we saw the Mall of America. It was pretty cool. When we talk about prevention, clothing is going to be a huge thing. If you haven't noticed with all the cold injuries, right? A lot of it involves clothing. So clothing is going to play a huge role in prevention. So clothing for the cold should have at least 3 layers, right? Your inner layer should be sweat wicking material. So you really don't want the moisture close to the skin. You want it to be able to be drawn away from the skin. So then that material isn't getting soaked. So then you don't have like wet clothing on you.
And it just like holding everything on you.
Correct. That middle layer should be insulating, right? So that's like your wool and stuff like that should be the warm part. And then your outer layer should be wind and water resistant or waterproof. Right, so that tends to be a little bit like kind of like a windbreaker kind of material, right? And these layers should be easy. You should have layers that can be easily added or even removed, right? So if you get like overly hot, you should be able to remove a layer easily.
Yeah, because you don't want to sweat because then the bottom layer is getting your sweat and that defeats the purpose.
Yeah, and then that just becomes damp clothing on you that could get cold.
As we say in hiking, be bold, start cold.
We do say be bold, start cold.
Because you can add layers.
You can add layers. That's true.
So you don't start sweaty.
Yeah, no, for sure. Any kind of environmental thing, we have to talk about acclimatization. But from the position statement, it really seemed like acclimatization for the cold is really just kind of bleh. It's not as beneficial as it is for like the same concept for the heat.
I feel like the difference is like metabolically.
Yes.
Whereas like in the heat, your body is adapting to how to handle the heat. Whereas like there is a certain level of cold that your body just will freeze. Like it just.
Yeah.
And you can't, no more amount of training can adjust if your body is freezing.
No, for sure. And I think it also goes back to like our strategy of warming. It really just revolves around shivering, for warming. Whereas like for the heat, like yes, we do have the aspect of sweating, but I feel like there's a lot more control of that than just like okay, I'm just gonna shiver to stay warm. Like I feel like how much adaptation happens to make that better is kind of like how meaningful is that. So acclimatization, it does happen, but it really develops slowly. And honestly, it may just have a minimal effect. I mean, it could take over 2 weeks to get acclimatized to the cold.
Which is hard when, like, for example, some of the schools that you were talking about, how often are you traveling with them?
Correct. Yeah.
Like once a week.
Yeah. And even then, even like the situation of, okay, we traveled to Minnesota for a cross country meet. Well, like we were there for 3 days. Actually, not even 3 days. I think we were there 2 days. I can't remember. Definitely not more than 2 weeks. Right. And like that's not realistic for anyone outside of probably elite athletics, at least from a traditional sport standpoint. For like kind of our EAP prep or just like our treatment kind of preparation with any environmental condition, right? We're going to start with monitoring the weather, but for the cold, especially wind chill. Right? Wind chill is going to be huge in like frostbite, hypothermia. And kind of like the heat index, this position statement does have a little chart that helps you calculate wind chill. So it's pretty cool.
So you could also do that on like a WBGT.
Oh, yes. Yes, that's true. Or you want to make sure you have the things to be prepared for treatment. So having warm fluids, right? That's a good idea. Making sure you have warming blankets. Make sure you have warm water immersion, right? We're so used to doing cold water immersion, but right? Making sure you're prepped with warm water.
How do you keep that water warm?
That's the thing is you need
a cover.
That, and you also need more warm water to add into it to make it warm. And then you also should have a shelter where you can take them away from the cold and the wind. Another thing that they advocated for is like, especially for events, like contacting the local hospital to make them aware that, hey, we have an event that we might have cold injuries coming your way. And then this one's key because anytime we start talking about core body temp is making sure you have a rectal thermometer ready. But this one needs to be special because it needs to be low reading. So it has to be able to read under 95 degrees.
That's something I probably never would have thought about.
Right? Because most of the time when we're doing like the rectal temps are looking for elevated core temperatures, even in like research, right? They usually do it for like hyperthermia stuff. Whereas, for this situation, we want something that can read pretty low.
So I'm going back, but did it say what temperature you're looking for? Rectal temp?
For
hypothermia?
Yeah, hypothermia, it depends on the level. Mild is between 98 and 95. And then moderate is 95 to 90. And then severe is below 90.
98 to 95 as in our normal is 98.6?
98.6, yeah. So assuming 98.6.
If that's depending if yours is normal, because like my body runs colder than that.
Yeah. So I think if you're anything close to 95, you would assume, hey, that might be someone entering mild.
Right.
And then anything below, you're assuming, hey, that might be moderate, depending on their signs and symptoms too. But yes, that's the numbers that that you would be looking for, and that's why you need a rectal temp that goes below 95.
Crazy. I feel like it'd also be really hard to put that in.
I know, for sure. They did say, as with kind of most things with core temperature, right? Like the tympanic and the axillary and the oral, right? That's not going to be the best for core temperature. But
because your skin's going to be freezing.
Exactly. But they did say that if you used, I think it was axillary and oral, if that is reading over 95, they're probably not in a hypothermic condition. But you won't know if it's below 95 which level they are because it's not accurate enough.
Yeah.
But it could give you some confidence if you put it in, do one of those two, and you see someone at like 98, you're like, okay, well, they don't have hypothermia.
Right. Sweet. What's your action item? Be prepared.
Honestly, yeah, be prepared. If you're going to be in the cold, whether you're hosting in the cold or traveling to the cold, right, make sure you have all the items you need, or at least know how to get the items you need to rewarm.
That's fair.
Yeah.
We didn't talk about space blankets.
Well, that was my warming blankets comment.
Oh.
Yeah. I didn't necessarily talk about the space blanket. It was just make sure you have rewarming blankets.
Yes. It's funny how much of this translates like when like what we keep in our first aid kit for like hiking and stuff.
Yeah. No, that's true.
So, like we said, this is a Category A CEU. Thank you so much to Athletic Training Chat and Clinically Pressed, our partners. So, if you are interested in getting your certificate, make sure you head down to the show notes below and click on the link. They will take you to the website where you can watch the video, or if you've listened to this already, then just follow the steps and it will automatically generate a certificate for you. If you're interested in other CEUs, we also work with We also work with MedBridge, and you can sign up for a subscription, and you can actually get $101 off your subscription with code ATCorner. And those CEUs are good for a year. And then if you are interested in our other episodes, we do more than just CEU episodes here on why do I suddenly not know the name of our podcast? On AT Corner. We also have story episodes where we bring stories from real life athletic trainers and talk about a highlight topic. We also have highlight topics in interview episodes where we bring on experts in their field and they talk about their highlight topic. And then we also have education episodes just like this one.
Yep.
I think that's all I got.
Thank you for helping us showcase athletic training beyond the tape. Bye.